go. So my name's Oliver Townsend. I'm Head of Connections and Change at Platform, a charity based in South Wales. With us today, we have Maria Bell from the National Commissioning Board, Richard Dooner from the Welsh Local Government Association, and Chris Bolton from Audit Wales. Today, we're going to be talking about tackling the myths around procurement and commissioning and audit, which is probably not the necessarily scintillating Thursday morning that lots of people would say, although I shouldn't say that because actually I blooming love commissioning and procurement and audit process. So I'm not sure whether that says something about me or the topic. The context today is that all three of our speakers are based in Wales. We are talking about a Welsh system. However, a lot of the procurement processes are UK-wide, and so we think there's something about the way in which we approach things in Wales, which other organisations across the UK can learn from. So some of the things we'll be talking about are very much Welsh-focused, but there is a lot we can learn from. So if you are listening thinking it's not entirely relevant in terms of exact applicability, please bear with us, and we'll have lots of really interesting conversations, and we'd love to hear from all of you as well about how it works in your areas. So without further ado, I will introduce Richard, and over to you, Richard. Thank you.
Thanks, Oliver. If you could pop some slides up for me, I'd be grateful.
Everything a second.
Thanks very much. And good morning, and thanks for inviting me along to come and have a chat with you today. We're going to be talking about reforming procurement to deliver for local communities. Can you go to the next slide, please, Oliver? I have to discipline myself not to keep pressing the screen here because I'm not flying this plane. But hopefully this morning we'll be able to talk about how some of the procurement rules are changing. I think Oliver alluded to that just now. And what it means when we're moving from the previous convention, which was to tender on the basis of most economically advantageous tender, to most advantageous tender. It's a small change in the acronym, but it's quite a major change in the application of law in the procurement rules themselves, and in fact, what it is that procurement officers are able to do. We're going to look at wellbeing outcomes, and we're going to be looking at what procurement specialists are doing to help councils deliver Welsh policy, which is really what our political leaders require councils to do, and how we provide vital services to communities in Wales. I'm Richard. I'm the lead officer for procurement at the Welsh Local Government Association. And I'll be exploring how our National Procurement Network, which is it's an organisation that for our lead procurement officers in Wales, how we're addressing those challenges and what we need to do to deliver for the people of Wales. So, next slide, please. I do procurement, and it is our habit to say the first question we tend to ask is, what's the spend? And that's what I'm going to do here this morning as well. So here we're seeing what councils spent in 2022 and 2023. It provides us with a reasonable indication of what the spending is likely to be in the next year. It shows here a total for all Welsh councils of approximately £5.5 billion. Now that compares to procurement for all Wales public services, which is around £8 billion. And these amounts, can you go to the next slide, please? Yeah, and these amounts buy quite a lot of goods and services. we tend to categorize those goods and services into various areas, such as highways, buildings, food, energy, and indeed social community care, supplies and services, which is one of the areas I've highlighted on this slide here. The total amounts here really are just to indicate the importance of procurement in this area and to show the totality of the spend in sort of round figures. Just note that the way we calculate these amounts and the way the data is managed isn't entirely accurate. We take this data from the payment systems that councils use. In other words, these are amounts that are invoiced. We categorize it by the main activity of the organization receiving the payment. And then there are analytics that occur within that. So the more granular the information gets, the less accurate we tend to find it becomes. There are quite large categories marked other, and within other, it would be healthcare services, social community care, supplies and services for adults and children, just as they're shown here. But this is our best overall view. Much more granular information is available at individual authority level and indeed service level. Next slide, please. So what does that mean? Why am I showing these telephone numbers? Well, it means it's a big lump of public money. Very simple terms, it's a lot of money. And that brings with it a lot of goods, a lot of services, but it also brings a collective duty, which is to play our part in what that spend does and all that it buys. Now, you'll note that on this slide, I've highlighted the word all, because I mean all that it buys, and what we buy when we receive services from third parties to provide services to the public is a lot more than what we've written in the contract specification. And that's particularly important going forward. And I'll talk more about that in a moment. I would certainly appeal to you that this might be done in common purpose. I think the old stereotype of the procurement department being the ones who say no is long gone. It's well and truly in the past. Nowadays, the procurement guys are more likely to say, well, this is how we might go about achieving that outcome that you're looking for. Even though we're highly regulated and we have to be very mindful of the regulations are there to encourage good behavior, good practice. And we have to understand that we do have a responsibility when we're handling public money to do it properly. And the reason we're doing it is not to spend money. It's not, as somebody once called it, strategic shopping. We're doing this for the well-being of our communities. And that's right now. And a lot of right now is what we have to deal with. But it's also with a mind to future generations too. And there are policies in Wales which are there for future generations. And in procurement, we can help with all of that. The way we'd go about it is by exactly what we buy, how we buy it. We might call that specification, and we might call it the method of procurement, because there isn't just one way to do procurement. In fact, in different categories, there are very good professional reasons to use different approaches to how you deal with supply management. We also need to consider how we expect our providers to behave, which we might look at as managing performance, but also additionality. And additionality, I think, will become increasingly important as we go forward. And also how we collectively behave in providing core services to communities. So that would involve processes like contract management and service improvement, but it also involves how we collectively behave. And I'm sorry if I'm speaking about some fairly obvious things here, but a lot of this is obvious. And as procurement officers, we really have to be conscious that we can only do what we're told to do. It's not always down to procurement. It's also down to what procurement officers are capable of doing. And right now, that is one of our concerns, because we have to have the capacity and capability in local government to do not only what we need to do today, and certainly not to fix the problems of 2 years ago. We're very good at that. But how to deal with the challenges that we have coming up. And it's what's coming up that is important right now. So some of this is down to us, some of it isn't. And that's why I'm talking to you today, because I'm conscious of the part that isn't in our direct control. It's in yours. And I'll finish this slide by saying that there's a saying in procurement that you get the suppliers you deserve. That's well used by one of my colleagues in Powys. And when he shared that with me, that certainly got me thinking about all the ramifications of what he meant. And it's good because it means in good practice, you will get excellent suppliers, you will get good support, you will be helped, you will have no problems, because as problems come up, they will be dealt with because you've set up the right kind of supply arrangements, you have the right supply relationships, and you will go forward in harmony. If you don't do the procurement well, if you make the wrong choices, the wrong decisions, you will get the suppliers you deserve. So can I have the next slide, please? Okay, so a little bit about procurement there, but now I'm going to just focus on meat to mat, as we call it. There's a traditional stereotype, really, for procurement, which is all around economics. It's all around cheap, lowest price. Now, I can't pretend that's gone away. Austerity has led to even more pressure, and the pressure is on councils here to achieve as much as possible for the amount of public money that they get. But that money isn't just there to be spent, it's there to achieve an outcome. So it's the outcome actually that has to be achieved. And that's where we start talking about the most advantageous tender rather than simply the most economically advantageous. The government has changed the procurement rules. Buyers are now able to procure on the basis of the most advantageous tender. And well, under the new rules, they will, I should say. And those rules are scheduled to apply from the 28th of October, 2024. I can confirm there was some concern that the announcement of a general election might affect the implementation of the new procurement rules, but I can confirm that they did go through the necessary parliamentary process before the announcement of the election. So they do look like they are going to apply from the 28th of October. There's a lot of information on that from UK government and Welsh government, and I'll refer you in the first instance to the government's Transforming Public Procurement website for any information on that. We're also being supported by Welsh Government and Business Wales in terms of supply side around the new reforms, and there should also be support available through individual councils as well. So just to say that most advantageous tender is intended to allow better decision making by putting into law something we already knew. We've always known that advantage isn't only economic, that there's a lot more that needs to be considered. Now, in England, for the last 11 years, there's been the Social Value Act, which has defined what social value means there. And it's essentially about social, economic, and community value. The application of that act is well known in the UK. And for procurement as an activity, it's really proved to be a game changer. And it is still changing not only what procurement does, but how it operates as a lever for change within organizations and a lever for better practice going forward. Can I have the next slide, please? So in Wales, we don't have the we don't have the Social Value Act. We use the term wellbeing outcomes. We still know what social value means, by the way, and the term can sometimes be used interchangeably. But wellbeing outcomes are likewise about social, economic, and community, but they add culture and a Welsh way of working, which is linked to Welsh policy. And those policies are numerous. They include Net Zero Wales, which is an enhanced ambition to achieve net zero in Wales by 2030. There is the Wellbeing of Future Generations Act, which, like the Social Value Act, seeks to improve social value, but does go further. It applies in a different place, and it's been supported in a different way as well here. There's the Social Partnership and Public Procurement Act, which came in at the end of last year, but is due to apply with the other reforms, hopefully from October. And that is largely focused on workforce. It is largely focused on construction type procurement, but not only construction. In fact, the implications of the Social Partnership and Public Procurement Act go throughout all procurement and all categories, particularly where it comes to workforce and other important policies such as trade union recognition. So quite a lot to come out from the SPPP Act. The Procurement Act, which gained royal assent at the end of last year, and the Healthcare Procurement Act also apply in Wales, much as they do in England and Northern Ireland. There are some differences in the timings. For example, the Healthcare Procurement Act already applies in England, but it doesn't yet apply in Wales. We are still procuring here under the Procurement Contracting Regulations 2015. The Procurement Act, though, very similar in England and Wales, and as I said earlier, due to apply from the 28th of October. There are other policies in there. So, for example, I put an example here of the Environment Wales Act, which places a duty on public authorities to maintain and enhance biodiversity. In the social and community care type area, the Social Care Act, I would suggest, is also a particularly important piece of legislation here. Now, that's a lot of policy. It is a lot of policy, but it is one set of reforms, and it involves all of those things. Can we move on, please? Okay, a little bit here about wellbeing outcomes. The measures for wellbeing outcomes are in development. They're going to support multiple policies that I've just mentioned. And those measures are in development. They're in development by Welsh Government in collaboration with ourselves. They're going to be compulsory to Welsh public bodies, and they are going to be the responsibility of the wider organisations. So it's not something that's just going to affect these procurement and contracting. It's not a silo-based activity. It's going to be global. So councils will have to measure wellbeing outcomes and report against them. Those are going to be supported by operational measures, and the operational measures will include the current community benefits measures. I've referred to a Welsh procurement policy note 0120, that's on the Welsh Government website, that explains a lot more detail about community benefits measures. But it's also supported by methods and tools which are being developed to support the Social Value Act. I mentioned TOMS, which stands for Themes, Outcomes and Measures. And those methods and tools have been very well developed, and they're being piloted right now in local government in Wales. And lessons are being learnt from that, and we're moving on to apply those lessons and move forward with methods and tools that will work here to support what it is the councils need to do here. Now, public bodies are free to choose how they run their operations. The wellbeing outcomes measures are not intended to undo or redo any of the good work that's already been done on social value in Wales. And a lot of good work has been done on social value here. Fantastic work, actually, for those authorities that have acted. We've learned a lot from other parts of the UK around the role of procurement. We've learned a lot from providers' perspectives, and we've learned a lot about the local impact that might be achieved by different approaches. I think to summarize how we've done on wellbeing outcomes in the pilots, I'd say that the ones who've endeavoured have done well, and the more they did, the better they got, the better they did. That probably applies to many things in life, but certainly in social value, none of it comes free. Wellbeing outcomes, none of it comes free. It's all got to be worked at but the more you work at it, the more you'll get. Can I have the next slide, please, Oliver? Okay, so what we're doing about it, I just mentioned a little bit about what we're doing. Our network's got 73 offices in it. Those organizations are listed there. So it's local government, and it's local government focused and led, but it's not exclusive. We're very happy to work with the colleagues that we deliver services in conjunction with. We work very closely with these guys anyway. We've got to have a plan. We call it collaborative procurement in Wales, resourcing procurement to deliver in for future generations. That plan was established back in 2019, 2020. Quite a difficult time in local government, as it probably was for the, well, no, probably isn't the word I want to use, as it was for the rest of the nation. But we set this up back in 2019, 20, and 4 years later, it's proved that it was the right plan. We haven't had to change very much in it, just some detailed changes around how we organize our network. The subgroups we have within that include market intelligence expert group, and that's been set up to deal with some very peculiar market conditions that have existed around the cost of living crisis and international events as well. That has been running now for 2 years and is continuing to provide market intelligence to our councils, to our buyers. We're attempting to standardize documentation and, in fact, really to take a lot of the noise out of the process of tendering and contracting. Trust me, we don't want it to be any more complicated than it needs to be. We really don't. We would like it to be as simple as we can, as practical as we can, but unfortunately there are legislative requirements, and there are some very good business reasons why we have to contract and tender the way we do. We have an e-procurement group to support that, again, trying to use e-procurement in the most efficient and effective way, but also the most appropriate way for what it is we're trying to buy. And we have a support group for the themes, outcomes and measures pilots. We work very closely with Welsh Government Commercial around procurement reform, including the wellbeing outcomes measures. And there's a procurement centre of excellence called KEED, CYD. And if you were to search KEED procurement, you would find a website with very good advice on procurement process, procurement practice, and all sorts of good practice case studies around procurement in Wales. We've got common objectives here, which is, and that is essentially better procurement. We, Welsh Government officials like ourselves, really just want to help to deliver the policies of our leadership through most advantageous tendering and good coordination of our collective efforts. And that's important too, because resource-wise, frankly, we don't have the resource to do otherwise. We have to collaborate. We have to share the work between us because there aren't enough to do it all in one place. Next slide, please. So this is my final slide. You'd be pleased to hear, Oliver, just hitting the time scale now. So if we're just talking business as usual, and I'm just going to smile and wave because we're not interested in business as usual. We've also got really good connections locally. We've got a duty to support our colleagues in good practice, and we will do that. And even though it's tough, we'll still do that. But we want better. We're not satisfied. And by better, we mean better for Wales and for the communities we're living in. And I've used the word I don't care. Now, actually, I don't care who you are or what logo you happen to work under. If you're here, you evidently have an interest in this, and you certainly would have a role in that too. We've all got a role in this, and it doesn't matter if we're procurement, if we're provider, where we are. If we're involved in delivering public services, we've all got a collective role. So if you're interested in that, and especially if you're interested in some of the focus areas we have at the moment, which I've listed there: decarbonisation, circular economies, social and local economic value, and community. Well, we've got something for you when hopefully, no, not hopefully, It is good. It is good. So thank you for listening to this monologue from yours truly. Hopefully it made some kind of sense, and we'll hand over to the next speaker. Thank you.
Thank you so much, Richard. That was a really helpful overview of a lot of the changes, both at a UK level, but also in Wales. And I think obviously one of the big purposes of today, to start the conversation off, is around challenging those myths. I've worked in the third sector for coming up to 13 years now, and I've lost track of the number of times, we sort of say, oh, we can't do that because procurement won't let us, we can't do that because commissioning won't let us. So what's really refreshing is to see actually the structures, the legal changes, the procurement processes that you're talking about. Some of those shifts is really powerful, and the fact that they apply across the UK would be, again, really helpful. So I'll ask people to sit on their questions over the next sort of 20 minutes, and then pass it over to Maria. So I'm just going to get the slide up, Maria, and then
Thank you very much, Ollie. I think you disappeared partway through there. You muted yourself, so I'll pick up on the discussion whilst you're getting the slides up. Thank you. And I have to say, I'm delighted that we've been able to have Richard with us today, because he's been an absolute ally, certainly in my work across health and social care, an absolute ally in promoting, championing innovative, flexible approaches. I've had many a conversation about, they're telling me I can't do it, Richard. They're telling me I can't do it. Help me, make the case for why. And so a lot of the conversations we've had is about kind of risk approaches. So a lot of the reasons why people say, oh, you can't do that, or we don't want you to do that, is generally because of a perceived risk, a perceived barrier. And we've had some really fruitful conversations about, well, what actually is the risk? Who is the risk to? How can we break down some of these perceptions? So I thought I'd tell you a little bit today about some of the work that we've got going on in Wales, particularly about trying to challenge some of those myths in commissioning, really trying to promote some new and developing practice, and really support the commissioning workforce to develop their confidence, maybe to challenge some of the traditional ways of working, and really make the very best of the assets that we have across health and social care. So if we can have the next slide, please, Ollie. Thank you. Super stuff. So I'm here today representing the National Commissioning Board. And the Commissioning Board are a collective of like-minded people from across the sector who work in care delivery roles, in regulatory and commissioning roles. And we're collectively passionate about joining up and improving commissioning practice across health and social care. So we spent a little bit of time looking at what the mission of the National Commissioning Board was, and really getting to grips with kind of our values as part of, hopefully, system kind of change agents, I guess. So next slide, please, Ollie. So I wanted to talk to you a little bit today about some work that went into the development of a forthcoming Code of Practice National Framework for Commissioning, Care and Support, which will place new duties on local authorities and local health boards in Wales to establish standards of commissioning practice that really promote ethical and transformative ways of working. So in 2022, the National Commissioning Board facilitated the co-production of some proposed principles and standards for commissioning, planning and contracting of care and support across Wales. For those of you that might be interested in reading up about this, the report is published on our web pages, and I've just seen that we'll be sharing the slides, so you will have access to that report in either English or Welsh. And this report or this group reported into a technical reference group that was involved in putting together the forthcoming Code of Practice. So next slide, please. So in putting together, or in our discussions as a task and finish group, we drew from the human learning systems philosophy, and I'll have some links I can share with you to explain a little bit more about human learning systems. But we began to see through exploring the human learning systems approach, we began to see how the commissioning cycle can be used as a model or method for transformative change. So human learning systems in a nutshell is about really understanding that health and social care is a really complex system with a range of interconnected, interdependent facets, and that health and social care need to be seen as a whole system, and transformative change needs to intervene within that whole system. But at the centre of it are people and the relationships that they have, and that the way to really transform our health and care system is through continuous kind of exploration and learning. And that commissioning is not just about procuring for the here and there. Procurement is an element of that commissioning cycle. But it's also about improving and transforming that whole system and the people, organisations, processes and cultures within that system in order to plan for future generations. So it's not just about here and now. So procurement can often be about kind of here and now, but the wider procurement cycle is, you know, having let a contract, it's then really evaluating the change that those particular services are delivering and really understanding the impact that they're having, so those wellbeing outcomes. And our working group agreed that at the very heart of commissioning are people with strengths and assets that are part of geographic communities. So I think if you do another click, we'll get a bit of a quote coming up there. So we looked at, there you go, thanks Oliver. The working group agreed that what was really important for us in terms of transforming commissioning in care is that we want to, you know, hear that people feel they can plan their care, working with people who understand what matters to and for them, their family and carers and their needs, with their best interests central, giving them voice, influence and control, bringing together services and support networks that would achieve the outcomes important to them. So that's almost our vision for transformative commissioning, and that's what we want people to be able to say about the system. So in terms of those wellbeing outcomes and what matters to individuals and communities, that's really what we're aiming for. Next slide, please. So within our work, we also drew from Public Services Transformation Academy paper, which details traditional commissioning approaches and aspirations for future commissioning practice. And we discussed this with Welsh Government, who were the sponsors of our working group. And they kind of challenged us, our government policy lead challenged us to provide some examples then of what that change might look like and the kind of things that the system might need to do, some of the policy issues, you know, some of the areas that the system might need to change to be able to deliver on some of these aspirations. And again, key to achieving those aspirations, we're putting relationships first, building our understanding as commissioning officers of some of the procurement flexibilities and wider scope for procurement. Next slide, please. So alongside the work that we were doing as a task and finish group, our policy colleagues in Welsh Government asked ADSSC to run a survey of local authorities to understand a little bit more about their procurement practice, and there's quite a significant response to this survey. So you've got a little bit of detail there in terms of who the respondents were. Next slide, please. And the results of that survey showed that there was quite a range of kind of procurement approaches adopted for the procurement of commissioning care and support. Next slide, please. And one of the things we were really interested in understanding was to what degree, in terms of our procuring of social care, were local authorities using the light touch regime? And you'll see that most of the responders indicated that they used the so-called light touch regime to enable more flexible, innovative approaches to procurement. Next slide, please. And although there was still a sense that so despite that, there was still a sense that organisational contract regulations restricted full exploitation of this opportunity. And so in response to that, the forthcoming Code of Practice National Framework for Commissioning Care and Support will have a requirement that local authorities and local health boards must ensure that their internal financial regulations are flexible enough to meet the specific needs of commissioning and procuring care and support services. Next slide, please. There were also, through that survey, a range of positive examples provided of how local authorities had built outcomes into their procurement, although there was still some recognition that more needed to be done to develop the wider system's understanding of commissioning and local authority colleagues' understanding of what we mean by outcomes, and specifically whose outcomes were put into that procurement. So we've talked a little bit this morning about the wider kind of social value, community benefits, the wider well-being outcomes. But obviously central to this is being clear that when we're procuring care and support, that we are clear about what matters to people receiving that care and support, as well as maybe some of the system outcomes that it may be easier to focus on. So things like delays to hospital discharge or services that might prevent people from going into hospital, step-up services that might prevent people from going into hospital in the first place. So whilst those system outcomes are really important, we also need to find a way that we can write in, you know, the flexibility and creativity of our care providers to deliver what matters for individuals. Next slide, please. The survey results also recognised that procurement and contract management is often dominated by system pressures such as workforce, finance and bureaucratic issues, and that there was a bit of a worry about how we should engage in longer term contracts beyond the traditional 3 to 4 years, when there's just so much change and uncertainty within the commissioning organisations. So both in terms of some of the financial pressures, with worries of, you know, what could be negative budget settlements in the future, we really don't know, or certainly, you know, budget settlements that might not meet some of the inflation issues that we've seen, and some of the changing government policies and priorities, and how that might impact if we enter into the longer term contracts that seem to make better sense both for the individuals in the receipt of the services and our providers, who are really clear to us that it's very difficult. There's a lot of waste in constantly re-tendering. You know, there's a lot of money wasted in that, there's a lot of time, and actually we want to enter into these more relationship-centered long-term arrangements to better meet the health and care and wellbeing needs of individuals. Next slide, please. The survey also asked what some of the enablers might be for longer term contracts, but our respondents tended to detail more the benefits of what what they saw as the benefits of long term contracts, rather than what might enable longer term contracts. So I guess that's still something that we need to explore and learn about, and have discussions with colleagues here today who might be able to help us with some of that. Next slide, please. One of the other things that I found really interesting that came out through the survey is that alliancing was identified as a collaborative method of managing and sharing risks and rewards, while sharing assets and resources across the partnership. And this may possibly be a way forward. So partnering, alliancing type contracts may possibly be a way forward to help us to weather some of the uncertainties and changes. And there are some emerging alliances in Wales. And the National Commissioning Board is working with Ideas Alliance to explore opportunities. And I think if you click again, Oliver, that will just give the link there to Ideas Alliance for colleagues if they want to explore that a little bit further. So next slide, please. So I've talked a little bit about the National Framework for the Commissioning of Care and Support in Wales. This will be issued as a statutory code of practice, with a range of new expectations on local authorities and NHS commissioning organisations. And we anticipate that the final code will be laid in our Parliament imminently for implementation from the 1st of September. For interested colleagues, there's a link here to the consultation draft version, which has been, so the final code, I understand, has been revised based on the consultation responses. And in particular, some of the key changes have been made based on responses from particularly providers, that maybe some of the standards of practice expected from commissioners that were described as a should be strengthened to be a must. So obviously must do is statutory and should is, well, this is a really good idea, but you don't necessarily have to. Next slide, please. So I talked a little bit about the standards of commissioning practice, but before we really got into the detail of that, the working group really felt that the starting point should be to agree principles of consistent, ethical, effective and transformative commissioning. And there are 7 principles here which also have made it into the code, which I'm really delighted about. And we mapped, to start this, we mapped the principles of our core legislation, policies and strategies within health and social care, and engaged a wide range of perspectives to really gather the thoughts of stakeholders in terms of what the principles of transformative and ethical commissioning should be. And these were our final, in terms of the task and finish group, our final agreed principles. Next slide, please. The standards then are quite high level and cover a wide range of themes. So I guess consistent with some of those principles is that commissioning really must demonstrate, the principles and values of key legislation in Wales, so Social and Wellbeing Wales Act, Wellbeing of Future Generations Act, and should be proactive in addressing inequalities and the promotion and fulfilment of human rights. That all elements of the commissioning cycle should be given equal value, and that commissioning organisations should really make sure they have the capacity to really understand the impact of commissioned services on people's lives, really evaluate and review that before going back into that kind of retendering type cycle. And that it was really important to focus on the learning and development of commissioners, to skill them up so that they can focus on the longer term preventative approaches rather than the here and now. And I think, we were hearing that because of austerity, because of the economic environment, often commissioning is seen as a little bit of an administrative function, a back office function, where we've focused on really trying to safeguard frontline services as much as possible. But I suppose, as an ex-commissioning officer, my concern is that we've really lost some of the capacity and the skills in commissioning that we really need to rebuild, because it should be really helping us to transform the system into some of those aspirations and aims we see in such as a healthier Wales. We're also looking at the balance between thinking about how we measure the value of public services, and that whilst data and quantitative measures are really important, we needed to balance then that stories understanding the impact of people, so people in the centre, and various different qualitative evidence gathering messages as well, and that we needed to use both that data and that qualitative evidence to inform decisions over the future use of our resources, how we commission in the future. And some of that might, unfortunately, lead to decommissioning some services that perhaps aren't having the impact that people are telling us that's important to them. But that leadership needed to be open and transparent, and we needed to be clear about those commissioning decisions, when we tender, why we retender, when local authorities and health boards decide to deliver services in-house, when they make grants, when they focus on community development activities and entering into strategic partnerships or alliances. There's also really clear standards about fair work and the need for commissioning authorities to understand the full costs of both directly provided and contracted care, and the use of existing recognised costing methodologies to achieve some of the consistency in commissioning that the Welsh Government policy aims to achieve. And as we've mentioned, the importance of internal financial and contract standing orders being fit for purpose. Next slide, please, Oliver. nearly at the end, So just to let you know that the National Office for Care and Support in Welsh Government are putting together a range of implementation supports, including a publicly accessible toolkit, which will be launched later on this summer via the Social Care Wales digital communities page. Also providing training for commissioners in the principles of commissioning for wellbeing, a very different approach to commissioning training than has probably been promoted hitherto. Welsh Government and the Welsh National Commissioning Board collaborate with the Department of Health and Social Care in England and Scottish Government also to share learning and approaches to improving developing commissioning practice. And we're really trying to learn from one another's strengths and assets, share approaches to the way we're supporting the development of the commissioning workforce. In Wales, we're also working with Social Care Wales to produce resources to support provider and commissioning organisations to develop positive cultures built on strengths-based approaches, compassionate leadership, what matters to individuals and communities. And I think this resource aims to pull all these threads together into something kind of coherent and consistent, so that very often we use terms interchangeably, or there's lots and lots of things floating around, and this particular guide tries to kind of knit them all together and under a kind of positive cultures envelope. And I think the clear message for us is that for developing commissioning practice in Wales, at its heart, commissioning is about individuals and those relationships, the assets and strengths of our all the individuals in the system, and that place, that locality. And the new National Office for Care and Support in Welsh Government has a clear mandate to support positive change and consistent approaches to commissioning for public value. So we are optimistic about the future of commissioning in Wales. Thank you very much.
Thank you very much, Maria, and I absolutely always love hearing you speak. So in one of the things we talk a lot about in these conversations that challenge, but also across platform, is the importance of relationships, but also kind of being honest about sometimes the assumptions we make. So I first met Maria probably 4, 5, maybe 6 years ago, Maria, and I was working for an organisation where we were often campaigning for commissioning and procurement change. And yeah, after successive years of that, I had boxed myself into making assumptions about commissioners and procurement officers that would probably, well, no, definitely not fair. And then I met Maria and I thought, oh no, we can make change here, things can happen. And I'm just really delighted to see things coming through in those guides, such as community, an awareness of reducing uncertainty, and again, that focus on exploring and learning together, because I know that's been the journey I've been on. So thank you so much for that. I think there's also an element that we can talk about in the Q&A after, is that, of course, the procurement and commissioning can set criteria within the context of national government policy or UK government policy and national funding as well. So in terms of the campaigning that we want to do as organisations, I think without getting political, because we are during an election period and I'm not sure what people can say on different panels, but there is an element around the social conditions and the conditions we create for our public services. So in the interest then of bringing our final speaker on, again, someone who changed my perspective on auditors, which I used to, again, being entirely honest, Chris, just so it's out there, I used to think audit was where the cold hands went to kill all creativity. So that's my context of where I used to be. Just, thinking I could introduce you like that. So, and then I met Chris and he does the entire opposite of that. So yeah, over to you, Chris, and thank you again.
Thank you, Oliver. The cold hand of killing creativity. My father-in-law used to say, there's a quote from an American that said, was it the auditors love to watch the battle from the hillside, and when it's over, come down and bayonet the wounded, which is, he used to say, but to say misconceptions about audit. Thank you. Hello, everyone. Just to set the scene on this, I'm not speaking sort of about Audit Wales policy today. This is not that, because I don't know, we wouldn't have anything to say about this specifically. I'm here as myself, which is my confused self, in the terms of the sort of intersectional space I live between. I work in Audit Wales, have done for 20 years. I'm in the space of the doers, two people about audit and regulate audit particularly. I also come from the perspective of, I have another life outside of audit where I work in, I'm on the board of a housing association. So the world of trying to push on procurement to try and change our communities is very much part of what we do. So it's Merthyr Valley's homes, and very much in our, what we do as an organization. We're a cooperative. So we try to spend the money we've got in Merthyr Tydfil for the good of people in Merthyr. So we've been trying to do that. So the practical bits of trying to move that on. I've also been in a association, a social care provider I was on the board of. And that was very interesting at that time, where things like councils who had a living wage policy would procure services off us where we could barely pay our staff minimum wage. And that was a very difficult position. So the whole issues of commissioning and procurement, this is very much needed in this space. And my third bit, if I'm sort of in the doers, the done to, and another space of my world is I do some work with an organization called Ideas UK, which look at things around staff engagement and improvement and innovation. And I'm for them sitting on the British Standards Institution's standard setting board for innovation. So it's a very, this notion of an auditable process for innovation kind of jangles with some of the other things I want to talk about. So those three things, there might be some confusion in all of this. I do apologize, but you wanted a conversation that challenged. I'm going to cover some points in a moment, about 3 points I want to cover about context is everything, best practice is the enemy, and then being part of the system, which I think very much joins in with what Maria and Richard were saying. But first of all, I thought, should we have a quiz, if that's okay? I've got no slides deliberately, but a quiz, if that helps. So for my quiz, I've got 6 questions. And if you've got a pencil and paper by the side of you, I want you to self-score yourselves. I'm not doing Menti or anything. I can't go through the palaver of a sort of, what's it called, privacy notice or GDPR this morning. Pencil and paper by the side of you, nothing's being collected in. And I'm going to ask you 6 questions, and I want you to score them, if that's okay. And where I've taken this from is that organization Ideas UK I'm involved with. They do things like innovation readiness audits. And I pinched some of the stuff from that. And I think this point about change is very much linked to innovation. So 6 questions. Question 1, if you're ready. And now you're going to, so this is, might be an odd one to start, but someone comes to meet you in your organizational headquarters. You want to offer them a nice warm drink and a biscuit. How do you go about it? Score yourself. If actually, score yourself 1. If this is about actually you've got to raise a sort of requisition notice 10 days in advance, send it to the catering department and something will arrive, hopefully. Score yourself a 1 there. To the other side of the scale, number 5, score 5, you just take them to the drink station. That's the first question. Okay. Second question is, you have an idea for a small improvement for a task that you do pretty much every day. Do you? Just stay quiet. It's not with a hassle. Score a 1. Actually, number 5, try it out. See if it works. Just get on with it. That's the second question. Question 3, you have your small idea you just tried out, looks a bit promising, but you're probably going to need about £500 just to scale it up a bit, test it, pilot it, to see if it's something you could spread across the organization. Do you? Actually, number 1, you score yourself at number 1. Forget it, it's just far too bureaucratic and there's no money around anyway. Or number 5, could score 5 if you go to your line manager and ask them, because they've got a budget for this sort of thing, and give yourself a score anyway if it's in between on that scale. Question 4, while you were trying that little idea, something went wrong. I mean, it was kind of fairly small and harmless, but do you? Score yourself on number 1 end of the scale. If it's basically bury the evidence and no one notices and go away, walk away from it, or actually score yourself towards number 5 and say, hey, we've learned. Let me tell everyone what we've learned from this process. Almost there in the questions. That was question 4. Number 5, quite a little bit different here. That little idea you came up with actually worked quite well. And actually people have started to pay attention. The local trade journal or Richard Dooner has come along and said, this is brilliant, can we write a case study about it? do you think, oh, score yourself towards number 1 if actually, oh no thanks, we don't like to stick our head above the parapet, or go to number 5, score 5 if you tell your line manager who says, yep, here's the resources to go and work with Richard to write up the case study. And then last question, which is a very, very direct yes or no one. Has audit or regulation ever actually come into your organization and criticized or stopped you for trying some innovative process? Score yourself towards 1 if it's a clear yes. Score yourself, they have stopped you. Score yourself up to number 5 if they've never been at that space and they've actually come in and been quite useful and helpful. You know what comes next, don't you? It's kind of total up your scores. You say this doesn't go anywhere between yourself, and sort of add the columns up, and I'll give you some thoughts on what some that might mean in some of those scores. What I'm suggesting on that is actually, this is something about if you're scoring in the space of 10 or less on this notion of change and innovation in your organization, perhaps your culture isn't right. There might be things in your organization that are holding you back, and it might not be specifically the regulators. If you're scoring low and actually the regulators never come in and stop you do anything, you might want to have a look internally to start with. If you're up towards the 30 on this and you scored 5, 6, 5, 6 to 30, anything between 20 and 30 on this, great, well done. Let's have a chat. There's probably things in your organization that's helping you move into that space. That was just to kind of set the scene on some of this stuff, that it's not all, myth busting. It's not out there all the time that people are doing things to you. It's what goes on in your own organization matters as much as anything. So I hope you enjoyed a bit of interactive stuff there. So nothing's been collected, just to reiterate that. Just moving on to the other things I wanted to cover quickly around these 3 points around context, best practice, and the system. In terms of context is everything. COVID's been mentioned already this morning, but I take your minds back to that 6 months between March 2020 and September 2020. And from a change and innovation process, I'd argue that we've probably been the most innovative, and we drove more change through in 6 months than had happened certainly in my working career in the 15 years previously. And that was spending my life in the world of trying to be an agent of change and all these things. The world turned its head and all of these things happened. And I've had some conversations with people who've been writing things like innovation strategies and this, that, and the other. And what has struck me on some of that is amazing. Like they forget that bit, and we're back to drag us back to the old world. How can we write something that's very codified and pulling us back into an old space? And I think there's something very important in not forgetting what we can do when when the system changes. I did write a blog at the time that kind of one of the things that most ever read things I've written, that it went berserk. All sorts of people rang me up and asked questions, and it started with a quote from Dave Snowden that I'd listened to lots of times, which said that in any crisis, alongside your recovery teams and the response teams, you should deploy an innovation team as well to capture that learning, so you make sure you embed it and carry it forward. And I think that fits with what both Maria and Richard were saying about this is a continuous learning process. And that's the point about understanding context, because within any kind of change, and particularly in the innovation space, you talk about things like the drivers of innovation are almost threat, the burning platform people talk about. So starvation of resources, a big threat, or a massive change in the environment around them. COVID was all those three. And actually, in any, continue that learning process, we need to keep doing it. Interesting, I say all changes around procurement weren't all brilliant, were they? I remember, the stuff we might see starting to play out about PPE in England might not be, some of the great procurement, but there were brilliant procurement that happened around it. I've listened to some of the stuff that the shared services people did for NHS in Wales, managing to get stuff when we needed it. So I think that capturing it, and what did we do then, and how do we keep it moving forward? The bits that I say I've noted to myself here about what you need to do in those spaces is, you keep learning from what you do and explain how you've done it. So I think that fits really nicely with those principles you're talking about, Maria. So the human learning systems with Toby Lowe, I love that. It's deeply embedded in it. And I think that sort of leads on to the next bit about what gets measured gets done in these spaces. And that's the important bit. The next bit I just wanted to say about, best practice is the enemy. I got to context that with the sort of best practices, the enemy of innovation, and I'll put some of the links in the chat to blogs I've written about each of these things. And best practice, why it troubles me is because it describes only one way of doing things. And actually, I think that kind of stifles quite a lot in spaces, and it leads to an environment where if you are in a space where you've got very controlling systems anyway, if someone's talking about best practice, it locks you into things that don't help that continuous learning process and that continuous evolving into what better might be. I mean, there's some lovely examples in this world. The space, people will be familiar with post-it notes. They kind of, they're in all of our lives, and the notion of how 3M discovered those through a process that was way outside of any sort of practice. It came from an accident. Someone discovered a glue that wouldn't stick. But I mean, interestingly, 3M, when they adopted the Six Sigma system, which is a very structured best practice type process, they dropped from being one of the most innovative companies in the US way down the list. And there's something around that about being aware that there's more than one practice. So we had a discussion about this at the beginning, before the session started. There is best practice where there is one way. There's good practice where lots of things can happen and be good. But there's also novel and emerging practice, and we need to keep our eyes open for these in all these spaces. So yeah, that was my bit about best practice. I'm just going to come to the other bits. The last bit I was going to mention, an understanding and being part of the system. I really liked what you said, Maria, and Richard, that the system is important. And I was going to, if audit does one kind of thing, and influences is what gets measured gets done. And it's a quote, it's a Peter Drucker quote, and there's lots of evidence. What we measure drives people's behavior. So let's measure the right things. And on that, did anyone go to see the play Nye at the Millennium Centre last week? Phenomenal in so many. I've ordered the book with the script so I can pick out some of it. But there was a lovely bit in it at the beginning, if anyone didn't see it, where they're talking about Evervale or Nutridiga in the 1930s, where everything was going, was wrong, massive unemployment, and they were sitting there, how do we change it? And their point was, you get onto the committees, you change the system, and they got themselves voted onto committees and boards and governance structures where they change things. And I think that's the important thing about any regulatory environment or audit, is you kind of you go in and you set the standards that are needed. And I think, again, from what you were both, Maria and Richard, were saying, that's the bit where you make the change, you set the rules to do the things that matter. So I'm kind of suggesting that, and that's interesting, the place where I've tried to go and get involved around the British standards for innovation, to see, can we set something that isn't too prescriptive. One example, I have to put this in, I'll put the blog that's relevant to it. There are some examples where regulation has done some really good things about changing improvement. So anyone who's interested in racing fast cars and sort of F1 racing, there's a phrase called homologation, which I was fascinated when I first heard it. Some engineers told me about it, but that sort of the governing body set the rules for how these cars operate. Everything from down to, how your brakes work, to how much petrol you can put in, so much rubber you can have on your tires. And they said that, they all work with, get to the best they can ever be. And then they change the rules. The governing body homologates and puts something new in and says, actually, from now on, you've got to recover 70% of energy from your braking system, because that's where we need to go. And that's a really interesting example of where a regulatory environment is really driving hard to change things and push it in a direction. And in the blog post, there's some examples of people that came back and said there are other bits of regulatory environment where things like this have happened as well. So I think it's an interesting space where actually regulation can be a driver for innovation. So, I mean, that bit about, sorry, there's an interesting phrase you use. So you get the what do you say, Richard? You get the suppliers you deserve. I think there's a bit of this. We get the regulators we deserve as well. And I think there's an element of this that you picked up on, Maria. We've got to come back in and we've got to work and co-create this stuff with the regulators. So get into this. I think that's the really important bit. That's a bit of a wild ramble through some bits. I'll stick the links to those blog bits in it. But I think, in summary, for me, it's a kind of part of this is starting what's your own culture in your organization. Got to think about that. And is it right? It's easy to blame an external source. Actually get in and understand where your own culture fits about that. The second bit is the context of where this is. You know, is it the right time for all of this? But the important bit on that is it's a continuous learning process amongst this change. The third bit I want to say is that, you know, the bit about just recognizing it's more than one way to do stuff, and it's you know, best practice isn't perhaps just not to talk about it, just to, you know, talk about other things. There are more ways to do it. So emerging practice and good practice are just as relevant. But the big one for me is, say, being part of the system. And I think that was beautifully covered by the previous two speakers. If we want to change anything, we've got to be in, and you mentioned it as well, Oliver, we do this together. And, you know, it might be putting yourself onto a terrible board of deathly cold hand auditors to influence them, but it kind of, you know, it pays dividends in the long run. And so, yeah, and I think, you know, auditors and these people want to talk to us. So that's kind of what I want. That's what I've got to say. And I hope it's been in the challenge space. Thank you.
Thank you, Chris. Yeah, really, always really valuable hearing from you. And I hope my joke about auditors doesn't cause offence. Some of my best friends are auditors, so that's a lie. They are not. Really good points from everyone. As I kind of provide some reflections, I suppose it would be really helpful if people, if they've got questions they want to ask, either pop them in the chat or raise their hand, and I'll come to you in a second. We've got 20 minutes, so thank you everyone for keeping to time. Just a reflection, I suppose, on audit and risk is one of the things that, I have for a long time been on a board of a housing charity, as well as working in the charity sector for a long time. And my unofficial role on that board had been to be the radical, pokey, proddy person to kind of say, oh, should we be doing that? Should we be doing that? In the sense that I would always ask us to take more risks, or ask us to push the envelope a little bit, or, you know, not be too worried about audit. Obviously, make sure the governance is really strong. But interestingly, towards the end of April, I was voted as chair of that organisation. And what has been fascinating to me, being incredibly as reflective as I possibly can, is that suddenly my risk appetite has changed. As chair of a board, I'm now like, oh, because what's happened is I've become a little bit more isolated, as chair. Suddenly, I feel like I have to make more of those sorts of decisions. It's a lot easier to be poking from the position as a, in quotes, normal trustee. The moment you become the chair or in a leadership position, suddenly that nervousness takes over. And one of those things really for me is that fear. What if I suggest that the organization takes a risk, and I do that because I'm going by my instinct and professional experience, but actually, what if something goes wrong? And I think that's one of the really powerful things about having Audit Wales here as well. So we've got lots of hands up, so I won't take up too much time, but I was just wondering if the panel have a reflection on that, I suppose. How would you or how do you propose, or what's your experience of navigating that risk? Because that's me being very, very honest with people, but I was surprised at myself and how quickly that, I'm talking 4 weeks, in 4 weeks, my risk appetite shifted. So I'd be really interested in your thoughts. Chris?
I've been there myself. So that and is an interesting role as going into the chair position. And I had the conversation about this yesterday with someone, and the way I'm helping myself around that is finding a balance of people who are board members who are still pokey, and who are, and there are some who are very focused on the risks as well. But you need to sort of, if it moves away from yourself, you need someone to fill your pokey space, would be my suggestion.
Great, thank you. And then Maria or Richard?
For me, there's definitely, if we're going to change the system, we're going to need some bold and courageous leaders, I think. But I guess for me, it's about not allowing yourself to be isolated, and bring in, be clear that if something is to change, then it isn't, whilst you might be accountable, the person at the top of the tree may be accountable when it comes down to it, that a decision is based on kind of some degree of evidence, and that you've got allies with you, and you bring people with you as part of that decision, but also then really breaking down that risk. So when I've tried to do some innovative commissioning and procurement, and people desperately worry about the financial risk, the reputational risk, really sit down and boil that down in terms of, well, what is the worst case? What's the worst case scenario? What's the likelihood of that happening? So the worst case scenario might be really terrible, but the chance of it happening is infinitesimal. So if it did happen, how would we mitigate it, and how would we deal with that? But I think, they say each system, I think it was Deming again said, each system is perfectly designed to deliver what it's already delivering. So if we want to make change, we do need our leaders to be bold and courageous.
Thank you.
Yeah. I'd say there's a lot of good practice already out there. A lot of great things are happening and have been done in the past as well. But anyone who innovates tends to put themselves in a position of vulnerability. So the first thing that happens if there's good practice going on is there's a whole lot of people in the background criticizing it, or giving reasons why they aren't doing it is perhaps more likely. And the enemy I see to change and to good practice promulgating is the ones who sit back on their hind legs and just point and just criticize what other people are doing rather than actually trying it for themselves. I guess the lesson we're learning particularly through social value, is that you've just you can research it, you can read about it, you can discuss it, you can have meetings about it, but actually until the day you actually try it for yourselves and just try to apply it, nothing's going to happen. So really it is about that will to change. But also, and I'm sorry, this is going to sound it's a really practical matter, but a lot of my colleagues say to me, Rich, I'd love to do this, but at the moment, I'm just fighting a battle here, and I can't even get my head up to even give it attention. So I know I can do better if I did these things, but I can't because it's just me. And there's a lot of people in that position, certainly in local government. We think of public institutions as being these sort of massively resourced sort of monoliths that are capable of all sorts of things. They're not. A lot of them are pared to the bone, and they're just trying to keep services from falling over. So if we're going to move from that position to one where we're genuinely adopting good practice across the piece, we need to have thinking that supports that, and the will to change and the necessity to change. Some of that is driven by policy. So it's high level. It's the high level stuff that we're always calling for our leadership to give us the power, give us resources, and we're always fighting for that. Well, certainly with our programs for procurement, we've taken a slightly different attitude, and we thought we're not going to get the resources. What's going to happen to us is we're going to be cut. It's going to get harder. So we've then thought ahead and thought, well, when it does get harder, how are we going to do it? And not only how are we going to do what we are doing now, but how are we going to do this better? So we're trying to think about that, anticipate it, and go forward. And one of the ways we're doing it is by splitting up the work. So not hoarding the work, but being a lot less precious about who does what, and being a lot more collaborative around that. So I'll give you a practical example. It's not in this area of practice, but it's around building materials of all things. Traditionally, there were a number of local government-led building materials frameworks that were done. They were very conventional, nothing really changed in them. Bricks and mortar are bricks and mortar after all. That was then run by Welsh government as a collaborative exercise. That got cut, and it's now being run by a housing association. So it's the first time a residential social landlord has run a framework on behalf of councils. Now, at one stage, that would have been unthinkable. It would have perhaps the other way around, possibly. But the truth is nowadays, it's the residential social landlord that has the resource, the expertise, and in fact, the volume of spend that supports that particular framework. And councils are very happy to draw from it. So it's just one example of just a rethink really on how we work with our partners and how we do things differently. And sorry, I'm about to launch into another 20-minute, so I'll stop there. And I can see hands are up.
Thank you, Richard. I really appreciate that. Jackie. If you're speaking, we can't hear you at the moment. If that's not working, if you're able to type it in the chat, we can come to it then. One of the things, just if you're, just give you a few seconds, Jackie, if you can, I'll just talk. One of the things as well that I'm really keen about is how do we make sure as a system that we're not making sure we're only taking risks within the parameters set by what we see as possible. So again, one of the things we talk a lot about at Platform is actually, how do we change the way our services work? That's number one, one of our aims. The other aim is how do we actually shift the paradigm, the social paradigm, either the way we talk about mental health, the way we invest in our communities. And I think, that's a really helpful way sometimes to think about, is the change we're looking for systemic, or are we working within the system as well? So it doesn't look like that's working, Jackie. So I'll just ask if anyone else has got any questions. If you do come back, then please pop your question in the chat and we will answer it. Does anyone else have any comments or questions that they'd like to ask? I always lie at this point and pretend I'm really comfortable with long silences. Oh, we got a message. I can't read. Bear with me, sorry. Oh, Chris, sorry. Thanks, Chris. So yeah, relationships being key. Does anyone else have any questions? Jackie's come back in, so let's give that a go. Hi, Jackie, is that working for you now if you try and ask your question? No, okay. So the other question I have, and if other people don't have questions, we can finish early. We're not going to lock the doors and keep you in until half 11. Is when we talk about one of the key things for me is about relationships, and again within Platform we talk a lot about relationships. So relational. Oh, Jackie, there you go. I will stop asking. Can you come in now? Can you speak?
Can you hear me now?
Yes, brilliant.
Oh, thank you. Must be the laptop. Yeah. So this is very, very interesting to me, because this is actually about the integrated care system in England, which is slightly different to what we're talking about here, but the principles are very similar. So for those who don't know, the idea is that health and social care, which is mostly councils, of course, but also voluntary sector providers, should all work together to be one system. And of course, this is proving very difficult to do, and for procurement as well, as Richard was saying about when you're in a time of cuts, that's when it's difficult. And so we're in a situation where councils are having to make cuts in voluntary sector organisations, councils are making cuts in their own services, health making cuts in their own services. Now we are in a position which we've just about got ourselves on the boards, but we're still one or two people jumping up and down going, we're here, can you listen to us, please? We want to change the whole system and make it completely collaborative, so that when we're looking at cuts, it's not like somebody somewhere else that we don't know about is saying, well, we've got no money for the voluntary sector, we'll just cut this, this and this. But that all of us, the three sectors together, are saying, here are things we need to do, here's the money we've got, how we're going to achieve it. So we've got a long way to go. And I just wondered if there were any suggestions that might be helpful for me, because I'm actually going to the local integrated care partnership executive and the main meeting in a couple of weeks as one of the voluntary sector reps. So any advice would be very helpful, please.
Thank you, Jackie. That's a really, really helpful question. I'm really sorry, Maria. I'm going to come to you first before you've had time to think.
I thought you might. So I'm going to just tell you a little bit whilst I'm thinking in the background. Advice is a difficult one, Jackie. So in Wales, we have regional partnership boards that are required so are kind of similar to Care Act, is Social Services and Wellbeing Wales Act. And we have regional partnership boards, and the third sector organisations are members, they're required to be members of that. And we also have citizen or people in receipt of services and carer members. And so those are our main kind of planning structure. So there's some similarities with that. And in Wales, we have, so part of our Social Service and Wellbeing Wales Act, we have a duty to promote what is social value. The terms change. So third sector kind of social value, user-led services, collaboratives, cooperatives, is a duty to promote those organisations and increase the role of those organisations in the delivery of social care and wellbeing services in Wales. That's proved to be hard, and I think one of the worries we have is that as money gets tighter, we focus, eligibility for access to services reduces. We focus more on the acute end rather than early intervention and prevention. So there is a body of work going on in Welsh Government, really trying to strengthen the expectations on local authorities and local health boards. There's some great work. I think Kelly's had to go, but Kelly Huxley Roberts works for Lloyds Bank Foundation, and they have been writing with a small charities forum in Wales some recommendations for commissioning, because we're very aware that as money gets is reduced, those kind of grants, as often are to charitable third sector organisations, reduce, or they don't go up with inflation. So there's some attempts, I think. I'm not sure in terms of advice, other than I suppose some of the conversations I've had with our WCVA, our national organisation for voluntary organisations, is go to your commissioners with the answer, given the evidence. Go to them with the answer. They've got problems. Give them the answers. So if you serve it up on a plate, they may, because the reduced commissioning capacity, it might be easier for them to kind of jump on board with some of that. So I think it's about having the evidence of the impact. And I know there's some really great work gone on in North Wales about measuring and evidencing your social impacts. So I can put some links into the chat about some of that work. But almost kind of just keep knocking on the door and keep saying, this is what we can do. This is the difference that we're making. But this is what we need. So go with a strong business plan, I think. Pitch it. They are the dragons.
Thanks, Maria. Chris or Richard?
I can come in there if you like. I think there's some practical considerations that we have. Quite often, procurement leads are faced with answering, first of all, dealing what they must deal with. So what are my legal responsibilities? What are the must-haves, must-dos? What are the absolute red lines that I cannot avoid? Those things will tend to be done. And then we've got the things that could be done, are nice to do, are good to do. Those things are at risk, and the more austere the situation is, the more likely it is that those are the parts that won't be attended to. So it highlights the importance of putting the difference between having sort of bolted on, add-on clauses, add-on what nice to haves, and comparing that with what is core. And one of the things that's changing in the legislation, in particular the Social Partnerships and Public Procurement Act, which I think it's an act that's come in under the radar a little bit. I don't think it's generally understood what an impact that particular piece of legislation is going to have, because that makes core quite a number of things that at the moment are in the nice to have area. So I think there is a role for legislators, but there's also a role for those who specify services in the first place, is what we need. And sometimes it's a willingness to ask for less or to do less, and to understand that some aspects are actually better dealt with. It's not all you. Some aspects are better dealt with in a different way or by a different area. And that's traditionally been a very difficult thing to let go of.
Thank you. Chris?
Thanks. Just two things. One about it's interesting about evidence and what you use to the argument for why things should or shouldn't happen. I think that's a good place to start. But it's something we're interested in, about a phrase that's entered our world, is about how do you account for prevention, and that bit about actually the money you invest in this now, it will save a huge amount downstream. So I think there's interest in that bit. I'd really be interested in that bit Maria mentioned about what's been going on in North Wales. The other bit is, I think it's about some of the things about making bold decisions that was mentioned earlier. Not everything that goes on in a board, the board isn't an event in time, and sometimes to get the right decisions, it might be building those relationships and having conversations and getting to the right place before the meeting even happens. And there's a fabulous phrase that comes out of Japanese manufacturing processes called nemawashi, which is about digging around the roots. So it's a literal translation. If you're going to transplant a tree, you dig around the roots. So when you get there, it's going to survive. And how they make decisions is a lot of social interaction before the decision ever comes to. So when you go to the board, everyone's okay. And I think that helps. And if you're going to have to make bold decisions, you've got everyone on board beforehand, so that decision's almost a formality. So all of those anxieties, risks, and happen in another space, and actually you might get a better decision by taking some of those things on board. So I'm trying to find a Welsh definition of nemawashi. Claudio Pryd is the best I can find so far, but prepare the soil.
Yeah, no, that's really good, really inspiring. So I'm going to blame Maria for this very last one for the panel, because you mentioned the words Dragon's Den, and I can't resist a gimmick. So one of the things that continues to come through in the New System Alliance is often people in the third sector, local authorities, housing, across the whole board, can often feel despairing of, how do we actually do this? And one of the things that comes through time and again is the importance of relationships, the importance of place-based delivery and services, of working with communities. So we have 2 minutes, and I was wondering if you've got any 2, 3, 4 sentences max, inspirational words that would help us get to that. And I'm not going to volunteer anyone. I'm just going to pause, maybe to give yourself some thoughts before. Yeah, what's one thing that we could do to really help us on that journey? Some words of wisdom to leave us with. Go on, Chris, you look like you're ready. Oh, you're muted.
This is a massive discussion. This has nothing to do with Audit Wales, but this is, I think, is a huge opportunity in the cooperative model as a model of economic organising. So my advice is think about that and engage someone like Compass to have a talk about how could your service be run, or how could you be run around a cooperative model. So just disclaimer, nothing to do with Audit Wales. That's my own personal view of the world.
Brilliant. Thank you, Chris. Maria?
Okay, so I guess summarising what I've said, be bold, be courageous, and be a positive disruptor.
Thank you. And then no pressure, Richard.
I'm just going to take my advice from the world's most intelligent fish, and just say, keep swimming, just keep swimming.
Yeah.
Swimming.
And I suppose my observation, just so that you know, I'll put myself in the same fiery line as the rest of you, is what I've learned is take your sustenance and gather your hope from people who think like you but differently from you as well, and come to things like this. Make time in your working day to find people that will challenge you and give you ideas and make you feel like there's hope, because if you're on your own in an organization, it can feel incredibly lonely, incredibly tiring. And actually, when you come to events like this and others from other organizations, I think it can refill the cup and give us the energy to go on. So a massive thank you to all of you for logging on today. Massive thank you to our 3 brilliant speakers who I think will be changing the world in the space of audit and commissioning and procurement, which you might not get told about that often, but I do genuinely mean that. It does make a difference, because that's the building blocks that help us do the stuff we need to do. And I just want you to know it's not unnoticed, and we really appreciate it in the third sector across Wales. You are making a big difference, so thank you. Yeah, keep in touch about future events. Thank you so much, everyone. Feel free to send us feedback, and we will send recordings and presentations around. Diolch yn fawr.